Before we jump into the episode, I want to let you know that I've written a step-by-step guide to help you through the process of securing your first role in health informatics by providing you with concrete examples of what roles to search for, common skills requested by employers, example interview questions, and much more. If this is of interest to you, you can check out the show notes of the episode where I have a link to the ebook below. Now, let's get back into the episode. Hi there. Welcome to the Health Analytic Insights Podcast. This podcast is all about creating a community of like-minded individuals who are passionate about the field of health informatics. I hope to share information and advice in topics such as health analytics, digital health, biomedical engineering, and data visualization in healthcare. And in exchange, I would love to hear from you, dear listener, about your experience and interest in this field. You can drop me a line at HealthAnalyticInsights@gmail.com, and this email, along with any references discussed during this podcast, will be listed in the show notes below. If this resonates with you, don't forget to follow and subscribe to this podcast, as I'll be releasing new episodes bi-weekly. When I first graduated from my master's in biomedical engineering, my impression was that after all the schooling, it would be relatively easy to find a job in my field. However, this was not the case at all. What really helped me to get my first job was primarily the network I grew during school and after school, attending events related to digital health and health informatics. For instance, I attended an event called Hacking Health, which was a hackathon where people from multiple different backgrounds got together to try and use their individual unique skills to help solve a healthcare problem. And the team that I worked on included developers, clinicians, and engineers, and our focus was to build a mental health app targeted for doctors. I learned a lot being on that team, but one of the best parts was I was able to grow my network and meet people from diverse backgrounds. This furthered, in my opinion, my job search much more than just sending my resume into the dark void of Indeed or LinkedIn. So speaking of the job search, one of the pain points when it comes to searching for a job in health informatics is that this field is still fairly new. Therefore, it can be confusing for new grads to even know which roles to apply for in health informatics. And in this podcast episode, I'm going to provide some potential roles you can apply to today in the health informatics field. So one role is a clinical systems analyst. Some hospitals will use software vendors to produce computer information systems which best suit their needs. A clinical system analyst can be the in-between person to communicate needs to the vendors from the end user. So for example, if you had a vendor in the EHR space, such as Cerner or Epic, you could be the person who's communicating between Cerner and Epic and the hospital system, which is implementing this software. And this can be done in the form of documenting user requirements on how they interact with the system and how this can be improved. In this role, you can be responsible for documenting any ongoing changes to the system and researching improvements or integrations that could be added to the system for improved usability. In addition, there might be an opportunity for individuals in this role to train external users on the system. The work-life balance of many of these roles can be dependent, of course, based on the organization, but it tends to be generally a 9-to-5 role, and individuals might only be expected to work overtime during emergency situations. The next role you might want to apply to is the role of the Ehr Analyst. The role of the Ehr Analyst is similar in job duties to the clinical systems analyst, but can be more specialized to a specific EHR. For instance, if your hospital is implementing Cerner, the organization might be looking for someone who's well-versed with Cerner, who can help guide clinicians to use the software in the hospital. Cerner is really on my mind because it'll be interesting to see how Cerner evolves with this acquisition by Oracle. So I'll leave an article in the show notes detailing the acquisition, but I will definitely be watching this space as things progress. On the other hand, Cerner or Epic might be looking for someone who can implement the software into different healthcare organizations. So you might be the Epic representative who goes into the hospital, trains and educates clinical staff on the use of Epic, and acts as the in-between for the clinical team to communicate any gaps or risks during the implementation process. The job might be more intense and might require more traveling and overtime work overall. The next role is a clinical decision support analyst, and the focus of this role might be on building reports to help guide evidence-based decisions within the healthcare organization. This can look like an individual analyzing the data and writing queries using SQL, which stands for Structured Query Language, programming language, to manipulate and extract key information from databases. Then carrying out descriptive statistics using programs such as R, Python, or SAS. And finally, visualizing the analysis using tools such as Excel, Crystal Reports, SSRS Reports, Power BI, Click, or Tableau. So this role will most likely involve presenting your results to stakeholders and will require strong communication skills to be able to explain technical concepts to a non-technical audience. This role is a good balance between working both your soft skills in terms of communication and presentations and your technical skills in terms of your analytical skills. Finally, the last role that you might want to apply for as a new health informatics grad is the role of the methodologist. The methodologist is focused on developing and analyzing clinical research projects. And the analysis done in these research projects can help to inform clinical practice and create relevant benchmarks that healthcare organizations can use as a reference for where they should target their key performance indicators. For example, as a result of several research projects and studies completed, a healthcare organization can understand what the average hospital readmission rate should be based on the location of their organization and the size. They can work to be well below the average through a series of programs and intervention techniques. So the role of the methodologist can include carrying out literature reviews of the current body of work, identifying data sources or survey methods needed to obtain relevant data. And in addition, this role can be quite heavy on the statistical analysis to ensure the correct methods are chosen when analyzing and summarizing statistically significant results. This role is quite technical and will most likely require a strong foundation and interest in statistics. But again, similar to the other career paths, might be a typical 9-to-5 where overtime might be required in unique situations. So I hope this podcast episode helps you to understand some roles that you can apply for in the health informatics field after completing your degree, and which areas you might want to explore based on your own personalities and what you want from your work-life balance.
Thank you for listening to the Health Analytic Insights Podcast. I'd love to hear from you about topics I should cover in future episodes. Please consider subscribing and leaving a review. Have a wonderful day.